Welcome back to the ACT program webinars for healthcare professionals. I'm Robin Geiger, SVP Clinician Advocacy for Ingenovis Health. We're excited to bring to you and welcome our guests today. And I must say that I will be sharing some really abbreviated bios, starting with Dr. Kavitha Reddy. She is an emergency medicine physician and Associate Director of Employee Whole Health in VHA Office of Patient-Centered Care and Cultural Transformation. She is a fellow of the American College of Emergency Physicians and is board certified through the American Board of Integrative Medicine. She has received several awards for excellence in teaching medical students and residents. And she is also an assistant professor in emergency medicine in the Department of Medicine at Washington University School of Medicine. Next, we have Ms. Jana Boehmer. She's a registered dietitian and nutritionist. She's currently the employee wellness coordinator at the James A. Haley VA Hospital and Clinics, as well as a clinical champion for employee whole health in the VHA Office of Patient-Centered Care and Cultural Transformation. Say that twice fast. She's a co-lead of the Chief Wellbeing Officer Program, as well as a co-lead of a VHA Reducing Employee Burnout and Optimizing Organizational Thriving Reboot Task Force Implementation Team Workstream. She has worked for the VHA for 17 years in a variety of nutrition roles, including Chief of Nutrition and Food Services, before following her passion to focus on the health and well-being of employees. Glad to have you here. Next, we have Mary Gallagher-Seaman. She's a registered nurse, whole health consultant, working on the employee whole health team. Mary has been an RN for more than 30 years and maintains ANCC certification in both gerontological nursing and as a nurse executive. She currently serves as co-lead of the Chief Wellbeing Officer Program. She is the recipient of the United States Undersecretary for Health's Award for Innovation in the Department of Veterans Affairs Community Living Centers, as well as one of the recipients for the New York City Federal Executive Board Award. Excited to have you here. So if we could start, we're just going to start this off right. We're just going to dig right into it. We're here to talk about clinician burnout and provide any tips, any trends of how we're addressing these things. And hopefully this will be really helpful for our audience. We're going to start right on our questions, and we're going to talk, collectively as a group. There will be time at the end of this recording so that you can ask questions. And if you have any questions along the way, feel free to add them to our Q&A. Okay, so starting with any of you, please feel free to unmute your microphones. What are you seeing within your health system as contributing factors for clinician burnout?
Robin, thanks for having us all on. I'll come on first to talk about this. We've actually been taking quite, I think, a progressive look at how we can address clinician burnout in VHA, in the Veterans Health Administration. And you mentioned the Reducing Employee Burnout, Optimizing Organizational Thriving name that Jana and I are both a part of. And this group is really led by the highest levels of leadership in VA. And why this is important is they took the time these last couple of years, especially coming out of the pandemic, to ask employees, to ask people, what is driving your burnout? And so through thousands of emails, our all-employee survey, listening sessions, we were actually able to really look at what are those drivers of burnout. And I don't think this is going to be a surprise to anybody on this call today. I think you'll be shaking your head yes as you hear these, because I know for me, they really resonate as a ER doc as well. It's workload. And by workload, I mean competing demands, keeping up with documentation and administrative burdens, while still trying to do the thing that brings us joy, which is seeing patients. It's psychological safety. Do we feel comfortable with our leaders? Do we feel comfortable with our team? Do we have those interpersonal relationships that help us thrive, or are they kind of sucking the life out of us at times? And that's what it feels like. It's job autonomy. Can I actually craft my job the way I want? Now with the virtual construct that makes it more complicated too. Can I work a hybrid life, or do I have to be in work all the time, physically in work? It's values conflicts, trying to do the right thing, and the system doesn't always do the same thing that is in alignment with my values. And do I start to feel moral distress? And then recognition. We heard a lot of people feeling they don't feel valued, they don't feel recognized for the work they're doing. And so these are just some examples of the focus areas that we saw of concern for clinicians. Again, I don't think that's going to be shocking to anybody on the phone.
Right. Mary or Jana, did you have anything to add? I know you're working alongside each other, so you're probably seeing those same things. Okay, so our next topic that we'll be moving to on this, in line with this, is, are you seeing similar stress and burden for all clinicians? Because we know that, most clinicians, and even in different professions, pharmacists, nurses, all of these allied, they're all seeing some levels of burnout. So how does this look within your health system? Why don't we start with another, like Mary or Jana?
Sure, I'd be happy to step in. The Surgeon General's report on addressing the healthcare worker burnout really kind of shows that this is across the board. There's rates that have slightly differences between clinical specialties, but the rise is really the thing that's across the board for all of them. Physicians went from on average 44 to currently, I think, about 63% reporting burnout, depending on their clinical specialty. Nurses rose from 2019 to 2020, we're at 62%, with that really being felt by new nurses in the field. And pharmacists, about 58%, social workers ranging from whether they're working in some of the more extreme cases where they report almost 80% where involving children endangerment or mental health issues. But across the board, the pandemic has really enhanced that feeling of burnout for many. So yes, it's across the board.
I was just wondering what your thoughts are, Jana, on, I know we talk about the pandemic, of course, but I think burnout was already pretty prevalent. And then, the pandemic just worsened that effect. But when we're talking to maybe some different professions, like Jana, what are you experiencing in your line of profession for nutritionists, dietitians? How are they fearing this?
Sure. Not any different than the rest of the clinical staff. It really goes back to some of those system demands, some of those drivers that Kavitha mentioned, the increasing pressure, the increasing conflict of priorities. How much time are we actually able to spend with our patients versus how much time are we spending in the electronic medical record? How much time are we having to spend on things that are not value added because they're either inefficient work practices, they're redundant? So regardless of the discipline, the issues related to burnout are very similar across the board.
Right. And we're seeing the same thing in the public sector as well. No, I don't think that anyone's immune to the possibility or the risk of burnout. So it's really interesting to have you all here today. So I would really like to know, what's VA approach or recommendations for improved clinician work-life balance, well-being. I know that you have the Chief Wellbeing Officer program, and I'd really love to know not just about the role, but also what are some of the elements that they cover or that they are, tackling within VA.
Yeah, I'm happy to start with this one, and then my colleagues can, of course, chime in. So I think it's really important to acknowledge that there is multi aspects that go into burnout, and the VA is really looking at a multi-pronged approach. So on one hand, you have to address the systems and organizational drivers, the systems and organizational issues that are causing some of those things. So, we talked about inefficient practices. We talked about redundancy in workflows. Even things as simple as if you're having to go across to multi-rooms to get medication that's not available, that's inefficient. Can there be things more readily available? So there are the systems, organizational issues, the inefficient practices, the workflows. Talk about training. Are there trainings that we're requiring clinicians to do that are maybe the organization decided they need to do, but they're not truly necessary for their license, for their credentials? There's also the personal resilience aspect, really looking at the employee well-being side. So we can't ignore that side either. We can't pin burnout on individuals and say, if you were more resilient, this would not be an issue, because we know that those system drivers are a big problem. But we also have to make sure that we have an organization, a culture of well-being in place, that we are providing things as simple as, are your nurses taking their breaks? Do they have time to step away and truly have their lunch? Are they able to have access to really healthy foods, or are they fueling themselves, with caffeine and sugar? So the personal side of health we have to look at as well. The VA has really been fantastic over the years of rolling out whole health. And specifically when we're talking about individuals, we have employee whole health coordinators within the organization. And those individuals are looking at what matters to the employees. What are the things that they can help individually to make sure that employees are feeling valued, feeling that they have the resources they need to take care of themselves. The Chief Wellbeing Officer program is very new. I could talk about it forever, but I would love for Mary or Kavitha to get their voice in the room as well.
Thank you.
Sure, Jana. Yeah, and I love the passion that we all have for this. So that Chief Wellbeing Officer is really a leader, a strategist, and an advocate specifically for clinicians. And in addition to the areas that Jana talked about, that personal well-being, the resilience piece of it, the practice efficiency, there's also that culture of well-being. How do you create a culture? And the single kind of biggest thing you can pin that on are supervisors. Do you feel valued in your team? Do you feel part of that team? Do you have a servant leader? Those are really important pieces. So supporting leaders to be leaders while they're surviving in an environment that has some real issues, if they're feeling burnout already, kind of that sandwich from the employees and upper management piece. So Kavitha, anything that you'd like to add?
Yeah, it's been a wonderful experience. I mean, people out there might recognize that term, Chief Wellbeing Officer or CWO. We're greatly informed by Stanford's work and Stanford's framework around professional fulfillment. What's exciting to note is that we are embarking on hiring at minimum 18 of these Chief Wellbeing Officers across facilities. And for those of you that don't know, VA has 140 medical facilities across the country. So not only are we seeing those 18, but almost close to 10 are actually hiring themselves just because they feel like this is the right next step to do. So why is that important for all of you as clinicians? I think when we're doing our day-to-day work and we run into those inefficiencies, we don't always know where to turn or if somebody's advocating for us. This role is really there to say, hey, if you're developing policies at the organization level, how is that going to ripple and impact day-to-day work for my department or my clinicians? And so it's really giving a lens and a voice to well-being that hasn't been there before. It's always been about productivity and bottom line, right? So I think that is really exciting to see happening. And the other thing I wanted to say is you brought up clinician work-life balance is it's really work-life integration, right? I mean, our lives are happening all day long while we're here at work, and work is sometimes happening when we go home. And so how do we actually try to create the most efficient practices, as Jana and Mary were talking about, during the day so that we have mental capacity to actually take care of ourselves when we leave the workplace, take care of our families, and all the other things that really fill our cup up.
No, that's super helpful. Some things that you said that you touched on, Jana, and you as well, Dr. Reddy, is within your chief wellbeing program, you're touching on all of these points, and you brought in clinician engagement, the sense of belonging, and how are what elements do you have some insight into, like what specific activities or ways that they're engaging clinicians to make them feel that they're included, or what are some things that our clinicians can do or recommend within their own health systems that may make this better for them?
Yeah, I'll start off, and then Jana and Mary, please follow in that. So really thinking about what are some of those promising practices that could work for all of you and for all of us, to be honest. So this is an interesting conversation, right? So I think what happens a lot of time for all of us as clinicians is we're really aware of the boulders that get in our way: documentation burden, payment burden, staffing shortages. And the issue that I think happens for most of us is they are in fact boulders that are not in our sphere of control or influence to move. And so we leave at the end of the day feeling disempowered, disengaged, wondering, is there anything I can do to make my work environment better? The idea here, and really how I want to answer this, is where can we always be looking for where we have areas of control, and then constantly trying to expand our areas of influence to be able to do more. So it may seem counterintuitive, but actually one of the ways to overcome burnout is to actually become more engaged in the process improvements that are getting in your way, process improvements of things that are getting in your way. So one of the things that we promote is a really robust quality improvement movement that could be different tools for all of you. For us, we've embraced things like lean and listen, sort, empower method, which is exactly what it sounds like. Allow your teams to really say out loud what's getting in the way of them doing the work, even if it's the smallest pebble. Like Jana said, having to walk to several rooms to get medications. And how do you as a team then solve for that? It's really important not to underestimate that every little pebble that you solve for goes towards improving your work environment. So start there. The second thing I want to say is get involved. Get involved where you're seeing well-being committees, where you're seeing these burnout reduction committees, just like we got involved nationally with our burnout efforts. Look at the literature out there, network with people. What you're doing here, just being on this call and learning about promising practices, is one way to do it. And then really when you think about your own well-being, I know a lot of us like to say, stop talking to me about meditation or yoga or things for my own self-care until you fix the things around me. And while there's truth to that, what that sets you up for is, again, putting your well-being in the hands of somebody else at all times. So while we're working on the boulders and the system issues, there still needs to be a focus on well-being. And some of the promising practices that we see around that are job crafting. How are you able to say, these are the things that bring me meaning and purpose in my work, and I'm going to start to say no and set boundaries around things that are not in alignment with that. Self-compassion. We're very hard on ourselves when it comes to being perfect and meeting all the goals. But how can we actually look at that with a different frame of mind and look at our mistakes as learning opportunities? Actually, that reframing has been shown to be very protective against burnout downstream. So these are just a couple of things. I want to turn it over to Jana and Mary to really elaborate on that further, because this is the work of many people in VHA.
So thank you, Kavitha. Yeah, it's hard to follow that because there's so many great things. I would even push a little bit further, because that's just who I am sometimes, and say, get involved on the national level, get with your professional organization, start using language. One thing that we've been lucky enough to have is real language around what is burnout and when are you exhausted, but not necessarily burned out. And having those conversations, it's not going to change overnight. And we all can be part of working towards a solution. And the other thing that really struck me when you were speaking, Kavitha, was something I'd heard early on in my career. When everything matters, then nothing matters. So when you really start to look at, where do I put my efforts, right? What do I actually have to do? And Jana mentioned this earlier, and what has been historically something that we just train up for, really looking at that as an efficiency practice. And Jana, I'll turn it to you.
Yeah, sure. I mean, everything they said, and I'll just add, we often in our group talk sometimes in the phrase, death by 1,000 cuts comes up. And so sometimes, even if you're able to make one improvement, it may be such a small improvement that you may not think, oh, my suggestion of that made a big difference. But if everybody made those little tiny suggestions, when they all start to add up, it really does become, oh, wow, that little thing and that little thing and that little thing made a major impact. So I highly encourage you, even if you think like, oh gosh, I'm just asking if they move the printer from there to there, that seems really silly. It actually may matter. It may, it's those little things that make a difference. So it goes back to that listen to your staff, listen to each other, hear what each other have to say, sort through what can you do, and then empower yourself to make those changes.
I like that. And I think, Dr. Reddy, you were mentioning it's more not just work-life balance, but integration. And I refer quite often as work-life blend, because you're always detached in some way. If you're in healthcare, whether you take things home with you, or whether you're thinking and running through lists. Often I have patients who will run through lists and they can't sleep. You're always taking it home with you, so figure out what to do with that, like make a list before bedtime. And I agree also, you, Jana, small bits, it really makes a difference. And sometimes, and I call them overwhelming thoughts, when you are just listing 50 things at one time. My husband will say that I used to do that, and still do sometimes. You list them all out at one time. You have to handle everything at one time. Realistically, we know we can't. So actually organizing your thoughts and ways that we approach this so that you're not increasing that room for burnout. I think that those are some ways that I've found that are really helpful. So thank you for that. We talked about work-life balance and well-being. What about just recommendations for wins or best practices for supporting resiliency in clinicians? Are there anything that you're doing internally within your health system we can expand, maybe that we can do in the public sector as well, or that our clinicians can adopt?
So I'm happy to start. Certainly mindfulness. We have an amazing opportunity to provide well-being services within VHA. We have a very rich complementary integrative health modalities for veterans. And while we can't treat our employees, we certainly can support well-being. So we have a number of mindfulness programs, which are very evidence-based for well-being, especially in healthcare. Among other things, we certainly have a number of exercise opportunities with, we just did a Y2K where everybody did a 2K, who was able to get out, really celebrate that, talk about being able to move. We have smoke-free campuses, which is just amazing now, completely smoke-free, a big transition from where we were. And then we have the opportunity to participate in some of the whole health activities as well, exploring on the circle of health, what really matters most to you, and where are you in their areas of self-care. There's actually a wonderful app for that that's open to all. And then we can kind of create where we want to go in support of our mission, aspiration, and purpose. So Jana, I'll turn it to you as well.
I'm on mute, sorry. Being a dietitian, that's probably the area that I would start to focus on when we talk about personal resilience and self-care. And the old saying, you are what you eat, people often think of that. But more importantly, I think if we start to flip that thought process and really think about how can what you consume, is it fueling and nourishing your body? Is it helping you or is it hurting you? And so sometimes we don't always think about the fact that our mood, our energy levels, our pain, consistent headaches, those things can really be impacted by the foods we eat. And so as healthcare professionals, how often do you actually get to stop and sit down, take your time and eat your lunch? Or if you're working the night shift, or are you just trying to consume on the go because you're in a hurry? The truth is you're probably consuming on the go because you're in a hurry. That's what happens, right? Especially if you're working a 12-hour shift. And so thinking about what are the things that both as individuals and as an organization you can do to help your staff. So from a personal perspective, I will tell you, as a busy mom, I have 2 little kids, work a full-time job. Let's be honest, I'm a dietitian. I'd like to say I never go to a fast food restaurant, but that's just not the truth, because there are times, we're going through the drive-through. But I also know that I have my selected spots pre-planned. This is where we're going to go. because I've looked at their menus online ahead of time. I've done the research, and I know that if we are going to be eating fast, this is where we're going, and I'm not even going to look at the menu for myself. I know ahead of time because I'm going to avoid those temptations. I'm just going to order X, Y, and Z. I also know that I have to make the choice to arm myself with things. So I always tell people the perfect food is an apple, a banana, or an orange. They can go in your bag at all times. They don't typically get bruised and bumped and yuck. You don't need a knife. You don't need to cook. But if you're, in between patients and you can step away, you can consume that apple, right? It is fueling your body. Things like healthy bars, limited ingredient bars, have those available. So those are things we can do individually. As a system, though, does your cafeteria have good, healthy options? I love it when I go into a hospital and I see they have things like sushi available. They have a salad bar. It's like, yes, we're making progress versus, is it just French fries, donuts, and hamburgers? So as organizations, we can make sure we have healthy choices. As individuals, we really have to start to arm ourselves.
That's great, Jana, and I'll add to that. I love that. I love hearing the passion really from the team, because every one of the team members really cares deeply about how we bring these resources to employees. Within the VA, we have the whole health model, as you heard just a few minutes ago, and that model is really built around different areas of well-being. So Jana just spoke to nutrition, and Mary was really speaking about that community and mindfulness. And so you can think about your own well-being as you develop your own personal resiliency plan from these areas, how you're moving, how you're sleeping, how your relationships are, how you deal with stress. And so that word resiliency is really important, right? I think we joke in our office that people are really frustrated with the word resilience and frustrated with the word mindfulness. And pretty soon we're not going to have words to use for our own well-being because people don't want to hear them anymore. People are frustrated with the word burnout, but it doesn't mean that they're not real and they're not necessary. So if resilience really means that we are learning to adapt and cope with stressors and challenges, then these are the ways we do it proactively. And what I'd like to add to that is we can look at the evidence and know that sleep absolutely impacts our cognition, our focus, our clarity. And yet we know clinicians compromise that time and time again, right? Because we're trying to fit it all on. People are doing charting at home in their pajamas, right? We call it pajama time now. These are not acceptable. And as a system, as a healthcare system nationally, we have to push back against that. So to take Jana's approach from a system level, we can follow the American Medical Informatics Association's guidelines, which say, hey, organization, commit to reducing documentation 25% in 5 years, and here's how you can do it. And one of the tactics they describe is doing a roadshow to make sure your clinicians know you don't necessarily have to document all of this to have a medical legally sound document. We are perfectionists when it comes to documentation too. So where can we cut down on what we're saying and still get the message across? Really great site to check out if you're looking for system level ways to approach it. But on an individual level, how are we protecting that sleep time and thinking about sleep hygiene? What are you doing with your devices? When are you putting away the technology so that blue wave light and that stimulation is not keeping you up at night? What does your room look like so that you can sleep? And how are you prioritizing that as a way to show value to yourself? So I think I really like, Jana, how you approached it, to constantly be thinking about resilience from an individual and a system level.
No, I agree. I think, and Jana, I don't know, you may have more to add. Please, by all means, please add more to that. But what you're saying is definitely resonating. But I do have a question, Jana, please.
No, I was just going to chime into that and say it's a both and. If there was just a simple answer, we would have solved it, right? If it was so simple, just do this or just do that, we wouldn't be in this situation. So I think it very much is a both and, both personal resilience and system solutions.
Right, and that actually segues into what I was about to ask. And if we could just dial down a little bit and slow down and talk about, Jana touched on some personal aspects, like your your visit to a fast food restaurant, which I'm the one that actually has to look at the entire menu again. That's me. Don't go with me and don't be behind me in a car because that's what's going to happen. I know the good choices, but I love all the other things that's on the menu. But if we could dial down just a minute and look at if you could share some of your personal journey with burnout, maybe, and how you were able to combat some of those experiences. Would love to hear those. I think that that may ring true to several people, and they may be able to identify with some of those solutions and suggestions.
Who wants to start?
How about you?
You first, but
Oh, okay. I didn't realize that. Yeah, thank you. So I'll say early in my career, I always wanted the next thing. It was very much about the prestige of it, about the making sure that I could get to that next level. And I was really loving, on many respects, what I was doing. I was working in labor and delivery, newborn ICU, and a really tragic event happened. We lost a patient, and I just couldn't go back. There was such a kind of a moral injury about what had happened. It was a maternal death. And it took me a long time. And I chose not to go back into that area. I stepped away. I raised my kids for a while. I always did some things. But that kind of not recognizing how much burnout there had been until it became a catastrophe that took years to recover from really impacted me. It's something I don't talk about very often, but had I known that I wasn't alone, that there were actual factors in there that were some beyond my control, some within my control, the outcome would have been different. I'm thrilled to be back, in active nursing for a long time now, in geriatrics and administration, and then was able to really think deeply about what mattered most to me, which was a legacy of making sure that I could help the next generation coming up not to go through that, and to being able to be part of whole health and then employee whole health working in this. Allows me to do a lot of job crafting around that. Mindfulness matters. I was able to get involved with some of those projects as well. And really thinking about keeping my eye on what really mattered most to me and finding an environment that shared the values that I had. I was no longer in a values conflict with the organization I worked for, which is really much better place to be.
Well, thank you for sharing that, Mary. Jana, would you?
Yeah, sure. So
share. Right.
It's hard to follow that, especially with very difficult situation. I think for me, a really simplistic approach is surrounding myself with like-minded people, because, burnout is contagious. So being around people that are negative, frustrated, looking at the issues, but not being proactive and coming up with solutions is draining. And all of the sudden, everyone else's burnout can become your own burnout. So really trying to align myself with individuals who are solutions driven, focused on if there's a problem, how can we try to solve it? What can we do? And just like, negativity is contagious, but so is positivity. So really finding people that support the work you do, support you as an individual, and recognize, we talked about work-life integration. Like, we don't come to work as a clinician and go home as a different person. But we also can't ignore the fact that, you guys saw me scoot away a few minutes ago. It's because there was something going on in the background. My dog was barking and I needed to go tell him to hush. That's personal, right? Like, so it really is that finding people that support you both personally and professionally has been a really good way to help me stay grounded in the work we do.
Very nice. Great recommendations.
Yes.
Yeah, exactly. I too have a, recollection of the moment I felt like I'm done with this and I'm ready to leave. But the interesting thing is I didn't know how to name it at the time. And so something that I think we haven't mentioned yet, but I want to mention before I even tell the story is being able to name when you're feeling moral distress, when you're feeling moral injury, knowing what those terms are, second victim syndrome. These are things that I think help normalize that we as clinicians do feel these almost traumas, quite honestly, throughout our occupation. And then once you can name it and normalize it, you actually create this space to be able to address it. But I think what happens to a lot of us as clinicians, we don't even know what we're feeling at the moment. And then we start to get hard on ourselves for feeling it. So let me just say before I tell the story that I think it's really important to also include seeking mental health support as a critical piece of what needs to happen for clinician well-being. Many of us could probably detail loss of colleagues or during the pandemic, especially the kind of suffering that was happening. And I just, as a group of people, we tend to not say that out loud. So I want to make sure I said that. And then quickly, I'll just say, for me, the recollection is being in the ER after 10 years of working and had a patient, elderly patient with a hip fracture. The daughter had brought him in, was very upset for how long it was taking in the ER for the care and also the eventual transfer that needed to happen for the patient, and began swearing at me and, very vocally sharing her frustration with me. And at the time, what I didn't realize is that I had been experiencing moral distress every day, multiple times a day, with conflicts and wanting to do the right thing, but not enough inpatient beds, not enough resources, not enough staff, not enough time. And so that was sort of the final straw. And I remember feeling like I was a complete failure to this person, to the patient, to the system. And like in retrospect, what I realized is this sort of need to constantly fix and be the person that finds the solutions for people was really wearing on me over time. The truth is, this daughter was frustrated that her elderly father was now going to have long-term placement needs. She was suffering. She wasn't necessarily mad at me as an individual. She was mad at the system. And if I had been able to separate those two things more effectively and really understand this is about the system and not me as an individual, so have that self-compassion, but then also name in the moment that that was traumatizing and debrief that maybe with peer support or other colleagues, that would have been extremely helpful to being able to put that down and name it, normalize it, and move on and seek the help that I needed. But I think after 10 years of that kind of thing happening over and over and over, I didn't recognize it. So that is something that I can do and still continue to do when I have a patient that seems disruptive or angry, consciously saying this is their suffering, their inability to cope with what they're feeling, not something that I have done wrong personally. And that's that reframe that Jana talked about. It's that positive psychology reframe, and I can move on a lot faster.
Right. No, thank you for sharing that. I appreciate that. Sharing my own personal story, thinking about, I can actually pinpoint when I had that feeling that, oh, wow, this is too much or this is overwhelming. But then you push past it and you keep going instead of dealing with it. When I was an intensive care unit nurse at a level 1 trauma center, University of Florida, and I remember it was 9/11. It was the day 9/11 hit. And I had a patient. I was so excited that he was finally able to open his eyes and he was no longer on his propofol drip. He was aware. He was, still on I think a non-rebreather, but he was not on the vent anymore. So he was taking those steps to, recovery. And the TV was on and the news was on. Had no idea. And I think about this because I had just lost a patient the night before, actually had, my mom had experienced a heart attack. It was like a really compounding week. And so I'm sitting there and I'm cleaning up and just proud of myself because I got him all cleaned up. He's kind of sitting up, waiting for his family. And he starts, literally, you could see that he was seeing it. But I couldn't see the TV for a minute. I was just looking at his reaction. I'm looking at all of a sudden he's bucking on this non-rebreather and he can't breathe and he's hitting the bed and he's pointing at the TV, and I turn around and I see it for the first time. and I can't deal with that because I'm dealing with him. But to have him, we had to intubate him back. It was just a lot. So that was my breaking point. And I think I would have been able to deal with it better had I realized that I was already to a point already. So sometimes what we do is we take experiences that we're having with a sick parent, or even when your dog isn't doing well. My dog is my family. She's like my daughter. And then you don't deal with it because you clinicians, health workers, kind of push past it. I will say there's some recruiters, there's people that in the health industry all experience it at different levels and push past it because they're sharing these experiences. So what I found worked best for me is, like you said, to identify it, to name it, to play, wow, I'm going through a lot. I need to step back and deal with this so that I'm my best self in order to take care of other people. And I think that's been my push forward. Every time I'm talking to a clinician or when I'm mentoring someone, I'm like, how are you doing? How are you really doing? And I think I saw that on LinkedIn somewhere. It's like, we always ask people, how you doing? But we're hoping for oh, I'm good. And then when I don't say that, you're like, oh my goodness. And then you don't know how to deal with it. So preparing ourselves also to be more empathetic is really helpful. And I appreciate the stories that you shared. Super helpful. What I'd like to do now is if we can is there any additional thoughts before we go to questions? Because you do have some questions, but are there additional thoughts to unique wins? What can we share with this audience so that they can kind of hang in there and know that there's always some type of silver lining, whatever we have to give on our last few moments here?
Sure, happy to unmute first. I would say that there's so many like-minded people that want to be doing this work, that want to be involved. That has been a huge win for me. Just look around who's in our room here today, right? And so many in the field want to do it. So I'm I'm heartened by that. And I'm so glad to be part of a real cultural transformation to changing the culture of healthcare for this.
Yeah, and I'll just add that, there's real power in camaraderie. When we went through the pandemic, one of the biggest things that actually helped people get through it was communities of support. So if you're out there at your facility, like Mary said, find those like-minded people, surround yourself with people that want to make change, that want to be proactive. And it actually has been really cool to see different communities, different clinicians and specialties coming together around their needs and feeling really energized around what they can do. But I do just want to acknowledge this healthcare system it's very difficult to practice right now. The burdens on clinicians are hefty. And so I think it's okay to also say we have to look at the healthcare system that we're operating in, and how do we actually start moving our system towards one that incentivizes quality of care, whole person care, team well-being. And so any of you that are really interested in how healthcare can move that direction, the National Academies of Medicine just released a fantastic report in February around what healthcare needs to do. And it's super exciting. I really encourage you to check it out, listen to some of the recordings around it, because I think that's what's going to get us back to being able to practice care the way we all want to practice care. So have to make sure that we say that out loud as well.
And I would say share your wins. As healthcare systems, we're really good at, sending out policy and letting everyone know what has to be done, what they need to be done. What we're not super great about is sharing the successes we've had and the wins we've had. So if you have successes, whether within yourself, within your teams, share them because they're encouraging, and they also may be best practices. It may be a very small win within your own team. It may be, an ICU nursing team that did something that improved their work process. Share that because it may help another work team. So I would highly encourage the sharing of all things, no matter how big or small.
I love that. And speaking about that, I know we've talked about the ACT program, and how, Ingenovis and all of our company brands are working to support our clinicians through advocacy, career, and providing them those tools, those mental health resources, career resources, anything that we can do to improve work-life blend. We are doing that, and we're pushing forward. We have an advisory, interdisciplinary advisory. It's a chief nurse advisory, but there's, physicians and others, and just moving things forward. And this conversation, I have to ask again, you touched on it a little bit, but keeping this conversation going about burnout, talking about resilience. Have we talked about it too much? Will there ever be a time where we need to stop talking about this? What are your thoughts on that?
Never enough. Sorry, couldn't help myself.
I saw you shaking your head. Mary.
Yeah, I can't help myself on this topic. I think that when we can have conversation using shared language, understanding we're not alone, all of that really begins to contribute to having more open dialogue about it, normalizing it, if you will. So I would say no. I would say something that we've really heard often is the word burnout thrown out there a little bit. It's, when you're tired or other things may be happening, but thinking about the real definition of burnout and really making sure that our language aligns with it, right? That depersonalization, right? When you start to see the cynicism creep in, the emotional exhaustion, not just that I've had a really rough day, but that emotional exhaustion. And then when you realize you're not feeling the rewards of the work that you worked so hard to get into, right? There's less value. That's more of the burnout piece. So using the word correctly and kind of being able to ask about it with each other. So.
Absolutely. I'm glad you finished with that point. That's awesome. Jana, did you have something to add? Okay.
I think Mary did a nice job.
I think she did as well. Then we can get into questioning, unless you had any thoughts, Dr. Reddy, before we do so. Okay, so we do have a couple questions. One of the questions is, the VA is a large system. Where's a good place to start implementing some of these concepts at a small, maybe nonprofit hospital? If you had to pick what element to start with first, what would it be?
I'm happy to jump on that one. I feel strongly that whether you're a large system or a very small system, huddling is important. And I'm guessing that small systems, big systems, they're huddling, whether it be morning huddle for nursing report, whatever the huddle is. But I think that's a perfect opportunity when you're already doing something. So we're not introducing a new concept, a new process, but you're already huddling. It's the perfect opportunity to listen to each other, to listen to what are those small pebbles, those death by 1,000 cuts, those small things that the team can sort through and then feel equipped and empowered to make a difference. So it's not a big thing. It's something that's already happening if you're already doing report, if you're already huddling. So I think that to me would be something that no matter what the size of the organization, it's something you could start tomorrow or this afternoon.
I love that. Looks like we lost Dr. Reddy. I'm hoping she'll be back on. There she is, pop back in. Okay, and then the next question. They're asking about patient population, how they have learned to navigate care system and the impact on clinical work-life integration. What have you done to influence these types of whole health concepts on patient population? And, I'm thinking this may be from within your health system, that this question's coming, but about those bragging and paying attention to, it looks like it aligns with what Jana was saying. What elements or initiatives have you personally started within your health system?
So certainly you've heard a little bit about that Chief Wellbeing Officer program, which is a really exciting piece. We're able also to align with Reboot for part of the larger work, the priority focus areas. Something as simple that's been really exciting is Operation Exhale. And this is the work of others within VA through Reboot. actually resetting the entire system, which is huge, as we mentioned, for 50-minute rather than 60-minute meetings and 25 rather than 30-minute meetings. And what that allows is literally a moment to exhale. You can use it for self-care. You can wait to, turn to the next task so that you're not minute to minute meetings back to back to back. Now, that's not necessarily the most important for clinicians, although many clinicians also have meetings, but that's really been a first kind of step that they've been taking to do that.
I love that.
Sure.
And I love that.
Yeah, and then the employee whole health coordinators that Jana was able to mention earlier, a person at each facility who really looks at all the well-being of the folks within that medical center, using some of the complementary integrative health modalities, as well as many others. So really putting whole health into action for employees.
Wonderful. Jana or Dr. Reddy, anything to add to that?
Well, so I think the question may specifically have been around how are we influencing patients around whole health as well. And so
Right.
I am going to I'm going to turn that over to Dr. Reddy, because she was previously whole health director at the St. Louis VA and really instrumental in changing the overall culture around whole health and patient care. So, and that directly impacts our staff as well. So I'm gonna let Dr. Reddy answer that one.
Well, hopefully you guys can hear me okay. Let me check.
We
with
can.
Having so much instability. Talk about stressors that lead to.
No, you're fine.
So I really apologize for that. The internet's coming in and out on me. Right. So in VA, we are very committed to bringing whole health or whole person care to our veterans. And interestingly, right, we've seen that when we practice this way as clinicians, it actually brings us more joy in our own well-being. And so this model is really about redefining healthcare, honestly, and thinking about it more than just the treatment-based appointment that we have with our patients, but also thinking about the social and structural determinants of health that impact their well-being. So how are we partnering with them to think about their meaning and purpose and how they achieve their goals? How are we introducing them to well-being practices that are evidence-based, that they can learn to do on their own and feel empowered to do in their own lives? I mean, truthfully, people only spend a small percentage of time with us. Their lives, 99% of it's happening out in their communities and their families. So think about this as clinicians. When those patients become more empowered and are setting their own goals, and you are helping them get the resources to be able to live out those goals, they come to you more engaged and more activated and ready to have conversations around some of the bigger issues for their medical treatment. And what we found through our large scale evaluation in VHA is that indeed is what happens. They become more activated, more engaged. We even see reductions in opioid use. We are seeing some promising data around reduction in procedures for pain. Just use pain as one example. Honestly, I think a lot of us struggle to figure out how to have conversations with patients with chronic pain because it's complex. But here you have a model that's looking at all the therapeutic approaches that can help their well-being. And so it is something we don't talk about often, but I think sometimes we as clinicians get burned out because we don't know how to fix something. We don't know how to solve for it. And that puts us in a super uncomfortable position because we like to be fixers. But what would it look like if we had a healthcare model that was really team-based and allowed for the patient to be the driver of that care, the patient to partner with us? And we are really there to offer our advice and our guidance, but really walk alongside them. It takes the pressure off our shoulders. And we start to feel really like we're co-pilots in something. And I think that becomes more rewarding. And we're seeing that in some of our data as well.
That's awesome. Yeah, I hear what you're saying, Dr. Reddy. It would definitely foster compliance if patients have more onus into their own health. They're going to be more likely to stick to those healthcare routines. And it does make it a lot easier on clinicians, less stressful for the clinician, and less likely to lead to that burnout. So I have to tell you, I've really enjoyed my conversation with you today. I really appreciate you being here. certainly hope that those who've joined us or those who are listening to the on-demand recording, that you'll continue this journey with us. And we're glad to partner with you to support clinicians on the lines of care. I think that's for us to sign off, and I'm really thankful to have met with you ladies today, and we appreciate your time.
Thank you so much for having us.
Thank you.
Thanks, Robin. This is really fun. Thank you, Jana and Mary.
Thank you
so
all.
much.
Bye.
Appreciate the forum.